I'm Dr. Mudit Khanna, consultant orthopedic joint replacement surgery at Wockhardt Hospital, Mumbai Central. I have special interest in treating osteoarthritis of the knee, both medically and surgically. Today, we will be talking about what a joint replacement surgery really means. Now, when somebody is suffering from osteoarthritis of the knee and has been suffering from osteoarthritis of the knee for a very, very long time, till the bone at the top starts grinding with the bone at the bottom and somebody reaches what we call as bone-on-bone osteoarthritis, the treatment is a joint replacement surgery or a knee replacement surgery. Now, a number of patients are really worried when it comes to a joint replacement surgery, and therefore today I would like to take this moment to explain what a joint replacement typically means. Now, a joint replacement surgery is not a transplant. A joint replacement surgery does not mean that we take the knee joint out and put a knee joint made of all metal back into the knee. A joint replacement surgery, when it comes to a knee replacement surgery, is only a procedure where we put a cap on the bone at the top, a tray at the bone at the bottom, and slide an artificial cushion in between. If we were to understand it better, a joint replacement surgery is a procedure similar to what you might have experienced at the dentist's when they put a crown on the tooth. So if somebody has pain on the tooth, the dentist puts a crown on top of it. Something similar is what is done in a knee replacement surgery. And let me take this moment to show you on this model what we really do in a knee replacement surgery. So while a normal knee has complete, good, nice, smooth cartilage, and we know that an arthritic knee has lost this cartilage and the bone is grinding on top of each other. So as we see on this particular model, the ends of the bone that are covered by cartilage are damaged, and therefore we need to resurface these ends of the bones. So what is done is, with special instruments and special techniques, the bone at the end is cut into a specific shape to accept a metal cap, as we can show in this model here. So the end of the bone is cut in a way to accept this metal cap. The bottom end or the top end of the bottom bone is cut perpendicular to create a surface on which a metal tray can go, and an artificial cushion is slid between the bones to complete a knee replacement surgery. So a knee replacement, I would say, is a misnomer. It is actually a procedure that involves resurfacing of the joint surfaces, and therefore it should probably be better called a knee resurfacing procedure, but this is essentially what is done in a knee replacement surgery. Thank you.